Hi, I'm Jim Swikart, Environmental Health and Safety Director. I'd like to introduce you to the hospital's new patient lifting system. It's really a great system. Let's take a look. The ceiling lifts are in 95% of the hospital's rooms. They're all set up the same way. They're on one side of the bed. They have the remote control and they have the bar that can be easily pulled out. You slide the boom over to where you need to use it over the patient. You'll set up the straps and then use the remote control. So again, very user-friendly, no manual lifting involved, and it's an improvement for patient and employee safety both. We've gotten a lot of positive feedback from the nursing staff on using the boom so far. It's only been in use a couple weeks. They find it's a real tool for them to lift things that they would previously have to do themselves.
The patients, after you explain it to them, they like it. They're a little hesitant once in a while on what you're doing, but if you explain it to them, they've been fine with it. A little bit resistance with some of the nurses on, do we really need it? We can just quick pull them up in bed, and thinking it's going to take too much time to adjust the straps and do that. But I think the more you do it, the less time it takes, and you know how many you need to use. And
so I think one of the biggest benefits is when I need to scoot somebody up in the bed and I'm by myself and we're so busy, as we all know that we are, and I can't find anybody to help me, I can scoot them up by myself using the overhead lift. The other thing that is beneficial is a lot of the times you get a patient up in the bed or in the chair and they're sitting for 2 to 3 hours, and then they're so fatigued that they can't get back to bed, that you can use the overhead lift to get them back to bed safely. The other benefit is a lot of the times when you're moving the patient in bed, it's uncomfortable for the patient, and if we use the overhead lifts properly, it's actually safer for the patient and they feel comfortable in the slings.
Wise for Sarah to invest in this. Is really going to save us, save the nurses back, and also helping the patients too. Because like Mrs. Well, I'm not going to mention it. One of the patients, you know, she cannot move and she's like a dead weight. She's like a jello. Yesterday we used it, myself and Beverly. It was so cool. We lifted her, you know, the one you have to, you cross it. We lifted the patient from the bed to the chair. It was just super. We did not strain. She was not straining. So you see, I think it's a wonderful.
I think the biggest advantage having these in the room is that you don't necessarily have to call for somebody for help and wait for them to come up to help you move a patient. These are right there in the room. Everything's available to you. You can easily do it yourself. I know I could do it myself. If I needed help, there's another nurse that can come right in and help you do it. You don't have to go find a machine. You don't have to find some patient transport to come help you do it. It's all readily available to you, and it moves around real easily too. You know.
What are you hearing?
It's easy to use and get off the wall, first of all.
Just hang around Mills.
So, you think we could get Dan to come in and, I don't know, he hasn't done anything all week. Maybe he could do one patient. I hope. I don't know, I'll ask him. Anyways, one lady.